this is what I like to call the four pillars of intra-optimal well-being. Intra meaning within, right? So you'll notice one thing that's not on here is like relationships and community and things outside of us have a really big influence on our resilience and our self-care, of course, right? But right here, I'm just talking about things you can do internally that can help. And oftentimes these are things that are very low hanging fruit that are underrated mental and emotional health self-care intervention. So for example, sleep, exercise, nutrition. Sometimes in some realms, these get talked about as self-care interventions for your mind, right? We all know that there's self-care for the body and things like that. So I just kind of wanted to present this and say, we're going to be focusing on the top of the pyramid here. MT stands for mental training. That's like meditation, not just meditation, but mindfulness, any type of self-awareness, contemplative thing that you can do that you're actively trying to take care of yourself. And we'll talk a little bit about that. The last thing I want to say on this slide is, sleep is probably the number one underrated mental, emotional, physical health intervention out there, meaning not a lot of people take into account how important sleep is. There's a lot of research that shows if you can get around 7 hours of sleep as an adult, at least if you're an adult, 7 hours of sleep, 7 or 8 hours of sleep, the 8 hour sleep thing, that's a little bit of a myth, although generally, at least here in the United States, the average adult sleeps between 6 and 8 hours. A lot of research has shown that 7 hours actually is helpful for optimal cognitive function throughout the day. But of course, it just depends for you, right? Teenagers need a little bit more sleep, but there's been so much research to show that the better you sleep, the better everything is that day. We're talking about education, we're talking about learning new information, mood, cognitive function, relationships, everything. So I just wanted to put a plug in for that. Think to yourself right now, how am I sleeping? Do I have a sleep routine? Do I put effort into my sleep? I personally struggled with sleep a lot throughout my whole life. And only in recent years, probably the last 3 or 4 years, I really leaned into the idea of sleep as a self care intervention. And it has drastically transformed my life. So I'm going to leave this slide for now, but I just wanted to put that out there because these are some of those low hanging fruit that if you start to implement in your life, you can really, really start to see a difference. And again, I'm using this presentation to talk about us, like we are all helping professionals and we need to care for ourselves. So this presentation is geared towards you, but these are also things you can teach to the clients, to the students, to the patients, to the people that you work with, right?